Great. Well, thank you for coming today. I appreciate for those of you in-house and for those of you who are virtually online. My name is Dave Brown. I am with TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network, and we've been working with the Mayo Employees Credit Union now for, I believe, 3 years to help folks who are ready to go on to Medicare and need assistance with that. So I've been doing this for 18 years, so anytime during the presentation, if you have questions, I'm happy to answer that. If you have questions online, if you can enter that into the chat, and we'd like to answer questions as we go along. So with that, we will get started. Disclosures. We do offer all of the Medicare Advantage plans that are available in Minnesota, and we're licensed in many states, including Arizona and Florida, where Mayo Clinic has facilities. We're also licensed with many of the Medigap supplement plans and many of the Part D prescription drug plans. So today will be a presentation on the basics of Medicare, and again, anytime during the presentation, if you have questions, just raise your hand and we'll answer as we go along. Our agenda is going to be, why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? The different enrollment periods and deadlines that you would want to pay attention to, the different costs that are associated with Medicare. What if you decide to work past the age of 65? Do you need to sign up for Medicare at age 65? We'll talk about that. And then we'll look at the different private insurance options. So around the time you turn 65, your mailbox generally fills up with mailings from everybody and everyone wanting you to use them to have their services for Medicare. And in the fall, especially during October and November, TV ads, that's all you see constantly is ads for Medicare. If you call that 800 number, that whether it's William Shatner or J.J. Walker or Joe Namath promoting it, they sell your information to a third party and they're going to keep calling you and calling you. So you can do that if you want to, but we're here to help if you would like our help. One thing that's unique to if you're a Mayo Clinic retiree, the Mayo Clinic uses a third-party provider called Via Benefits. And they have lightened that a little bit, but typically, if you started employment with Mayo Clinic prior to January 1 of 2001 or 2002, you're going to be eligible to go through Via Benefits, and with that, you're going to get health reimbursement money, typically, to help you with your payments and so forth. Mayo Clinic did announce last fall that you can go through us this year if you want to and still get your reimbursement money from Via, or you can go directly with Via. But I just wanted to make that aware for those of you who started employment with the Mayo Clinic prior to January 1 of 2002. So there are no costs for our services, whether you just meet with us for consultation or you actually sign up for a plan through us. There's never a cost for our services. If you sign up for a plan through us, we get paid a commission by the insurance carrier. And if it's a Medicare Advantage plan, the commissions are the same no matter which carrier you go with. If it's a Medicare supplement plan, it tends to be a percentage of whatever your annual premium is. Medicare is not a one-size-fits-all. Some people prefer to go with a Medigap supplement plan. Some people prefer to go with a Medicare Advantage plan. And we're going to talk about what those differences are in a few moments. Again, if you use us, we're available throughout the year. If you have questions, or maybe you got billed for something you know you shouldn't have gotten billed for, if you call us, we do three-way calls with the insurance companies, with you and the insurance carrier on the line, and help you get that straightened out if that happens to you. And then every fall, we actively review your plans. So one of the things that changes quite a bit in the fall is the prescription drug plans. 1 year, all of your medications may be in the formulary, and that's the list of medications that they cover. The next year, they may drop some out of that formulary. So you really want to make sure, once you're on Medicare, that you review your prescriptions at least, and we do that for you, to make sure that whatever coverage you're going to have going into January, that it's going to cover all of your medications. So original Medicare Part A and B. Part A is coverage for the hospital, skilled nursing home health care, and hospice care. There's generally not a premium for Medicare Part A. The Medicare tax that's been coming out of your paychecks, that's what covers the premium for Medicare Part A. There are deductibles that can be associated with that. If you go with a Medicare Advantage plan, those deductibles typically don't apply. If you go with a Medicare supplement plan, they may or may not apply depending on the type of supplement plan you go with. And then for Medicare Part B, that's for doctors and specialist visits, durable medical equipment, ambulance, all the outpatient type things that you would be using. There is a monthly premium for Medicare Part B. This year it's $202.90 a month. And if you fall into the high income category, we'll go over that in just a moment, they're going to add on a surcharge to that $202.90 a month. The annual deductible, that doesn't apply to most Medicare Advantage plans. It would apply to a Medicare supplement plan where you'd pay the first $283 towards your outpatient type things. Yeah. And then there's several things original Medicare does not cover. So it doesn't cover comprehensive dental, doesn't give you worldwide coverage, routine hearing or hearing aid coverage, routine eye exams or eyewear coverage, outpatient prescription drugs, fitness benefits. So why this is important is if you go with a Medigap supplement plan, the Medigap supplement plan is not going to cover any of these things with the exception of maybe fitness benefits. But if you go with a Medigap supplement plan, they're not going to give you coverage for dental or eyes or hearing. They're also not going to cover an annual exam anymore. Several years back, Medicare quit covering your annual physical. They do cover an annual wellness exam, which really doesn't amount to a whole lot, but that's what Medicare will cover. All of the Medicare Advantage plans in Minnesota still cover an annual physical for a zero copay. So one of the differences between a supplement and an Advantage plan is you can still get your annual physical paid for with an Advantage plan, at least in Minnesota, and you can in most Advantage plans across the country. If you go with a Medigap plan, they will not pay for your annual physical. So the different Medicare enrollment periods. Your initial coverage enrollment period is based around your 65th birthday. So you have 3 months prior to the month you turn 65, the month of, and 3 months following. A 7-month window is a time frame if you're going to enroll at age 65. This would be the time frame in which you would want to do it. If you're going to continue working and either you or your spouse and you're on whichever one's employer plan, if it's through the Mayo Clinic, if you're on an employer plan and you're going to work past the age of 65, you do not have to sign up for Medicare Part A and B at age 65. You can wait until retirement. And that's true for your spouse also if they're on the same employer plan. I have every day it seems like people tell me, well, a friend told me if I don't sign up at age 65 that I'll pay a penalty. You won't. If you're still working and on an employer plan, the rule is your employer has to have 20 or more employees. Well, obviously, if you work for Mayo Clinic, they have more than that. But there's a form Mayo HR fills out for you when you do go to apply for Part B upon retirement, and that prevents any penalties for not having signed up at age 65. You can sign up for just Medicare Part A at age 65 if you want to, because you're not paying a premium for that. But you do not have to sign up for Medicare Part B if you're going to continue working and have an employer plan. Any questions on that? Yes?
So the form from HR doesn't get completed until the working spouse retires, or is it yearly that
No.
HR has to?
That's a good question. So that form that HR will complete so you don't get penalized for Part B, that would get filled out. You'd want to start that process 2 to 3 months before you're going to retire. And then when you apply for Part B, that form gets submitted at that time to show that you had employer coverage. So it's not a yearly thing, it's just a one-time thing that they would fill out. You would request them to fill it out 2 to 3 months before you're going to retire.
For both you and your spouse?
For both you and your spouse, if you have a spouse that's on your plan, yes. Yes?
I have a question. So I took Part A. I'm still employed at Mayo. Took Part A in my initial period. I'm still in my initial period. Can I now reverse that decision and decline Part A because of HSA considerations?
Oh, yes, you can. So he asked if he could decline his Part A, and the only reason you'd really want to do that is once you sign up for Medicare Part A, you can no longer contribute to an HSA. So if you're in that boat, yes, you can contact Social Security and tell them you want to suspend your Part A.
Okay.
Yeah. Yes.
We have one question online. Can you define the difference between Medigap Supplement and Medicare Advantage? And does your income dictate which you qualify for? Which do you have to use?
Yeah, so those are good questions. Your income does not dictate whether you go with a Medigap Supplement or a Medicare Advantage plan, but I do have slides coming up to describe the differences between the two, so we'll get into those slides in just a few moments, so thank you for the question. The second enrollment period is your special election or special enrollment period, and this is going to be based around your retirement. So if you work, let's say you work till the age of 68 and you're getting ready to retire, then you have a special election period. You'd want to start that about 2 months before you're going to retire. 2 to 3 months you can actually sign up for Medicare Part B if you haven't done that, and Part A if you haven't done that. And then when you're retired, you have your Medicare card that's arrived in the mail, and then a month prior to that, we can help you find whatever type of plan that you'd want to sign up for to begin when your employer plan ends. Then once you're on Medicare, every year there's what's called the annual election period that runs every year from October 15th through December 7th. And that's the time frame in which you can review your coverage options. If you have a prescription drug plan, this is when we could review what prescriptions that you're on to find out, do you want to keep what you currently have or do you want to switch to something else because maybe your plan made some changes. If you have a Medicare Advantage plan, you can switch from year to year. If you went with a Medigap plan, typically you don't switch Medigap plans from one year to the next. But the annual election period, October 15th through December 7th, that's the time frame in which you can look at making changes. Yes?
When it's time to enroll for Social Security, do you make an appointment or can you do it online?
You can do it either way. So she asked if when it's time to enroll in Social Security, if you want to enroll for Social Security benefits or Medicare Part A and B, you can do that online, or you can go to your local Social Security office to do that. If you want help doing it online, if you give us a call, we'll schedule an in-person appointment with you if you're local to help you with that if you want our help.
Do we need any forms for that, like a birth certificate or anything like that?
You don't need a birth certificate, but the Social Security has started something new within the past year is you'll need your driver's license. They're going to send a link online if you do it to where you take a picture of your license and you take a picture of yourself, and it's just another way to help reduce fraud and make sure you are who you say you are. Yeah. Mm-hmm. And then one more enrollment period that's available if you have a Medicare Advantage plan from January 1 through March 31st, you have one more opportunity to switch from your current Medicare Advantage plan to a different Medicare Advantage plan, or just to drop it all together and go back to original Medicare. But typically the people who use this is, they really didn't read the materials they got that their plan sent out at the end of September. It's called the Annual Notice of Changes. And they thought, I like my plan, I'm just going to keep it for next year. And then they go to the pharmacy in January or February and find out one of their medications that was covered the previous year is no longer being covered. So especially if it's a tier 3, if it's a generic like Jardiance or Ozempic or something like that, those can get pretty expensive to not be covered. So it would be one more opportunity for you to find a plan that would cover your medications. So delaying Medicare benefits, working past the age of 65, you can compare, or we can help you compare costs and benefits of Medicare to employer insurance. If you have the Mayo insurance, or even I get some IBM retirees here, generally from what I've seen, their plan is a better value for you if you're going to work past the age of 65 than going on to Medicare. And both of those employers offer creditable coverage, so you don't have to worry about that. And then, like I said, you can apply for a Medicare Part A if you want to, but if you do, as we just discussed, it's going to impact your HSA contributions. So once you sign up for Medicare Part A, you can no longer contribute to your HSA. So if you do have an HSA, don't sign up for Medicare Part A or B if you're going to work beyond the age of 65. That rule only applies to the one who owns the HSA account. If you have a spouse, and they're not the owner of that account, then they can sign up for Part A if they want to. Yes?
Just follow that up. You can draw your money out of the HSA, however.
You can draw your money. That HSA money is yours until you use it. Yes. When you're ready to retire, the rule is if you're past your initial enrollment period, that 7-month window of turning 65, you want to stop contributing to your HSA 6 months before you're going to retire. So if you're age 66 or beyond and you know that you're going to retire or have a pretty good idea you're going to retire, you'd want to stop contributing to your HSA 6 months before you would retire. So a general rule of thumb is if you're going into the new year and you think, I'm pretty convinced I'm going to retire sometime this year, that's a good time to stop contributing to your HSA. What will happen if you don't? A lot of people forget. You can get taxed a little bit on your contributions if you've been contributing up until you retire. If you're 66 or older, it's not a huge tax consequence, but you would get taxed on that. You can apply for Medicare Part A and or B online. Again, you can call us and we can help you with that if you need help with that, or you can go to the local Social Security office to do that. And again, there's a form from your employer, and I'll have a picture of that in just a moment. It's called the Employer Verification Form. It's just it's a one-page form. This is what it looks like from your employer, and they get this from Medicare. It's just verifying that you had employer coverage up until when you retired. So this is what prevents the penalty for not signing up for Part B at age 65. Any questions on that?
That's for the spouse too, then?
It's for the spouse too if they're on your employer plan. And then income impacts. Someone online had asked, or virtually had asked. So there is, for lower income people, there's something called extra help. So once you retire, your income can change dramatically for some folks. And this chart shows, based on your family size, the percentages across the top are the percentage of the federal poverty guidelines. And if your income falls into one of those levels, based on your family size, once you retire, you're probably going to be eligible for some sort of extra help. If you get the extra help, it's going to reduce the cost of your Part B and Part D premiums, and it'll reduce the cost of your medications. Maybe it's not going to affect you, but I run into people all the time who aren't aware of this, and that maybe they've been on Medicare for a few years and they're just really struggling to pay for their medications, to pay for their Part B premium. If they've never seen or applied to see if they're eligible for extra help, if they qualify, it's going to make a big difference for them. So that is available in every county and every state. The other side of that equation is if you're in the high income category, it's called the Income Related Monthly Adjustment Amount. And every year, Social Security and the IRS review your tax returns from 2 years ago. They're always going to be looking at tax returns from 2 years ago. And if your modified adjusted gross is above these levels, then they're going to add on a surcharge. So if you file as an individual and your modified adjusted gross from 2 years ago was over $109,000 a year, the government's going to add on a surcharge to that $202.90. If you're married filing jointly and your modified adjusted gross from 2 years ago was over $218,000, they're going to add on a surcharge. So as you can see, the Part B premium monthly, if you go down that column, that's how much your Part B premium is going to go up based on if you're in one of those income categories. So if you're in the 109 to, or the 218 to 274,000 category, your Part B premium is going to go up to $284 a month. And the higher your income was from 2 years ago, the higher that goes up. It's also going to affect the Part D portion of your premium, and it's going to increase by the amount shown there for that. So, yes?
Does that include Social Security income and your retirement income?
It includes whatever would be considered your adjusted gross on your tax returns, yeah. Yeah, and then this isn't a lifetime surcharge. Every year that gets reviewed, and if you fall below the levels, these thresholds of 109 and 218,000, those tend to go up every year. But so it's not a lifetime surcharge, But every year it will get reviewed, and if you fall into those categories, you're going to be paying those surcharges. There are special exceptions to that where you can file an appeal. Let's say maybe you had an inheritance or you sold a house or it was a one-time thing. Oftentimes they will grant those types of appeals, but if it was just based on your income and so forth, they're probably going to deny an appeal like that. Any questions on that? Okay. So your private health insurance options, there are what's called Medigap supplement plans, there are Medicare Advantage plans, and then there are standalone Part D prescription drug plans. We'll go over these. So in Minnesota, we call them a little different than most of the country does. In most of the country, it's going to be called Plan G, Plan L, Plan N, Plan K, something like that. We don't call them that in Minnesota. We call them basic plans, extended basic plans. Some insurance carriers have a high deductible plan, and some have a copay plan. So those are available. Typically, depending on the type of Medigap plan you have, you wouldn't have a network, meaning anybody who accepts Medicare will accept your plan. It travels with you when you leave the state or the country, and if you move to another state, if you have a Medigap plan, you don't have to, or you won't be required to get a different Medigap plan when you move to another state. The downside to that is Minnesota tends to have some of the highest priced Medigap plans in the country. So it may be that maybe you move to Arizona where their Medigap plans are 40 to 50% less than what they are here. Or even if you move to Wisconsin or Iowa or somewhere, they're just less than they are here in Minnesota. But if you tried to switch to a supplement plan in the state you move to, you're going to have to go through underwriting if you have a Medigap plan, and that means they're going to ask you health questions. And if you answer yes to any of the health questions, they'll deny you supplement plan from that state, and you keep what you have from Minnesota. Again, one of the things that I mentioned earlier about Medigap plans, it doesn't give you dental, vision, or hearing coverage, and it won't cover an annual physical. It also won't cover prescription drugs, which is why we'll talk about standalone prescription drug plans here in a minute. Medicare Part C is also called Medicare Advantage plans. There are some counties that have what's called Medicare cost plans. But with the Advantage plans or the cost plans, for one monthly premium, they cover your medical, prescription drug, dental, vision, hearing, free gym membership, all those types of things. There are two different types of Advantage plans in Minnesota. There's HMO plans and there are PPO plans. If you go with an HMO plan, and if I meet with you, I tend to discourage people from going with HMO plans, but they're available if you want them. You're limited on where you can go. You need a referral typically to see a specialist, and if you're traveling, they don't give you great coverage. The PPO plans, you don't need a referral to see a specialist, and they give you nationwide coverage. All the Advantage plans in Minnesota, they're PPO plans. They have national networks to where if you're traveling, you're going to have coverage across the country. They do have provider networks. Minnesota's kind of an outlier when it comes to Medicare Advantage plans because we have carriers in Minnesota where 97% of providers are in their networks. That's not typical in most states. Some states you're lucky to find 50% of providers are in the network. So again, Minnesota, I like to say, has the best Advantage plans in the country based on the reasoning that 97% of providers are in network based on the type or the carrier you go with and so forth. There is, Olmsted County is a little unique, probably because of the Mayo Clinic, but there's only two Medicare Advantage insurance carriers that the Medicare Clinic, or the Mayo Clinic will take, and that is Blue Cross of Minnesota and Medica. So if you chose to go with a Medicare Advantage plan and you're in Olmsted County, you're going to have those two options, which they're good options, but you'll have those two options. The Mayo Clinic announced last year that they will no longer take the United Healthcare Advantage plans or the Humana Advantage plans. It's down to Blue Cross and Medica. Yeah, like I said, you do have a network. If you have an Advantage plan and you move to another state, or even you move to another county, maybe you move from Olmsted up to Dakota County or something, you would need to find a different Medicare Advantage plan, but again, that's something that we can help you with. So they don't travel as well as the Medigap plans, but your pricing. So people ask, well, what's the difference on pricing? So if you went with a Medigap plan where you didn't have any co-pays once you paid your deductible of $283, those are going to run you $300 or more a month just for your medical coverage. And then if you want prescription drug coverage, you'd have to buy a policy for that. And if you want vision and dental coverage, you'd buy policies for that. So you can get upwards of $400 a month on Medigap. With Medicare Advantage, in this area, you're going to get all that together for $150 or less. So there's significant cost differences between the two.
Is there underwriting?
There's no underwriting on Medicare Advantage plans. Yeah. With the Medigap plans, if you're a tobacco user, your rates are going to go up versus if you're not a tobacco user. With Medicare Advantage, they don't ask those questions. Yes?
For the Medigap and the Advantage, is there a top out-of-pocket expense?
So depending on the type of Medigap plan you go with, some of them have a max out-of-pocket. If you go with like the basic plan where you have coverage once you reach your deductible, they don't have a max out-of-pocket, but again, you would pay for your annual physical if you wanted one of those with a Medigap plan. With Medicare Advantage plans, they all have maximum out-of-pocket protection. So what that means is it's not a deductible you have to pay first, but if your co-pays were to reach whatever the maximum out-of-pocket is before the end of the year, then you no longer have co-pays on any of your medical. It's tough to hit your maximum out-of-pocket, but the thing that really drives that would be, it's called Part B medications, and it's going to be things like infusions or injections you get at a clinic. Chemotherapy would be a good example. So if you're going through chemo and you're on a Medicare Advantage plan, you're likely going to hit your maximum out-of-pocket. Okay, standalone prescription drug plans or Medicare Part D plans. This would get paired up if you have a Medigap supplement plan. Each carrier, insurance carrier's formulary is a little bit different, so if you meet with us, we're going to ask you for a list of any medications you're taking, and we'll look those up on the Medicare Plan Finder to find out which ones are going to cover all of your medications and at what cost to you that it would be. We can enter in whatever pharmacies you want to use and so forth, and there's even big differences from one pharmacy to the next when you're on Medicare. It may not be so much on your employer plan, but there can be huge differences in costs, even from like, well, you probably don't have Cub Foods down here, but CVS versus Walgreens or the Mayo Pharmacy or something like that. There can be some pretty significant differences between the two. So we go over all that with you, but there's different tiers of coverage. Tiers 1 and 2 are typically your generic medications, your maintenance medications like blood pressure, cholesterol, those things. Tiers 3 and 4 are going to be brand name medications. There may be some generic, more expensive generic medications in those categories. Some people are on Tier 5 specialty medications. And then a couple of plans offer what's called Tier 6, and that's just the lowest cost generic medications that would be in their formulary. There is a penalty if you don't sign up for prescription drug coverage when you're first eligible. So that means whether it's at age 65 or when you retire and leave your employer plan, if you don't sign up for prescription drug coverage and wait till down the road when you I meet with people all the time who say, well, I don't take any prescriptions, why do I have to have a prescription drug plan? You don't if you don't want to, but if you sign up down the road, you're going to pay a penalty for the number of years you went without one, and that penalty you're going to pay the rest of your life. So again, there are some very inexpensive, if you go with a Medigap plan, there are some inexpensive prescription drug plans that would be worth signing up for. If you go with a Medicare Advantage plan, the Part D is included with that. Any questions on that? Okay. And then a couple of years ago, the government started what's called the Medicare Prescription Payment Program. Some people, if they're on a plan and in January they're on some expensive medications, they're going to pay out a lot of money in January and February towards their medications. Well, the government is capping the costs of medications for Part D prescription drug plans. This started last year, I believe it was. The maximum out of pocket this year is $2,100. So if your medications are in the formulary of the carrier you go with, once you hit that $2,100, the insurance company has to pay 100% of the cost of your medications for the rest of the year. Some people will hit that in January or February once you're retired. At least for some people, that can be hard to come up with $2,100. So every insurance company has to offer you the prescription payment program. There's no cost to it, but what it does is instead of you having to pay that $2,100 out over just a month or two, it'll spread your costs out over the year to help you in your budgeting. And then if you sign up for that plan, when you go to the pharmacy, you won't pay anything for your medications. Your insurance carrier will bill you each month for your medications. This is fairly new. So premium costs with Medicare and private health insurance options. As we talked about, Medicare Part A, you don't pay a monthly, for most people, you don't pay a monthly premium for Part A if you've worked in the United States for at least 10 years. The Part B premium this year is $202.90 a month. And then Medicare Part C plans can run anywhere from $0 a month up to, if you're in Olmsted County, it can be over $200 a month, depending on the type of plan that you go with. The other side of that is if you go with a Medigap plan, your Part A and Part B premiums are the same, but Medigap plans, if you go with a high deductible plan, can run from $75. If you go with a plan where you won't have any co-pays after that small deductible, those will be over $300 per month. And then if you add on a Part D prescription drug plan, those can run anywhere from $5 a month to over $100 a month, depending on the prescriptions that you're taking and which plan covers those. And then if you wanted dental and vision, you'll be adding policies on for those sorts of things too. So this kind of gives you an idea of the cost difference between the two. And I've met with a lot of male retirees. Some of them go with Medigap, some of them go with Medicare Advantage. It really depends on what your preference is and what you're comfortable with. Any questions on that? Okay. So I gave you the handouts that are, the book is from United Healthcare. That doesn't mean we endorse United Healthcare. They just do a good job of printing those and they give them to us for free. So we use their brochures for handouts. If you're attending virtually, you'll receive this in a follow-up email. But on the sheet that has our pictures on it, if you want to be in contact with us, we have a phone number and an email address. And if you need help when the time comes, maybe that time's now, I don't know, just call our phone number or send us an email at medicare@truelink.com. And we typically meet people, if you're in this area, we meet right here at the credit union, or we can, if has to be an evening appointment, we can come to your house or whatever, but we'll meet you face to face if you want to do that. So if you want to do phone or virtual, we're happy to do that too. If you're out of state and need help, typically those are going to be phone or virtual appointments. So what questions do you have that you came in with that maybe didn't get answered during the presentation? Yes?
Through your experience, what would be the best plan for a type 1 diabetic?
So type 1 diabetic, it depends on what your expenses are going to be. If you have, the diabetic supplies, and some companies limit which manufacturer you can go with. Some have a broader issue on that. But with a Medigap plan, once you reach that $283, you won't pay anything for your diabetic supplies. With a Medicare Advantage plan, typically you're going to pay 20% of the cost. It's not, diabetic supplies don't tend to typically be a high cost item, but if they are for you, an Advantage plan, you're going to pay 20% up until if and when you hit your max out of pocket. Okay. So it really comes down to the Advantage plans can typically have lower costs for prescription drugs that you're taking than the standalone Part D that you would add on with a Medigap plan, but that's not always the case. So that's why we look at both for you to help you determine which one's going to be most cost effective for you.
Okay, because right now I'm finding that I just switched insurance at my work, and for the insulin pump and for the CGM, the monitor, it's, the cost is way more than it was with my previous insurance.
Oh.
I'm just wondering if that cost is gonna be the same when I go to Medicare.
So when you go to Medicare, the pump in that, you would pay 20% of the cost
Okay,
if you went with an Advantage plan. If you go with a Medigap plan, once you've reached your deductible of $283, they pay 100%.
okay,
You're just paying more per month for the plan.
okay, thank you.
Yes?
If we did time in the military, but not, like 3 years or more, but not enough to retire, are there any benefits that we should take advantage of that you know of?
Yeah, so the question is, if you served in the military and you didn't retire and maybe you don't qualify for TRICARE, if you're eligible for the VA, if you want to use the VA, I meet with veterans all the time who use the VA and said, I don't need a Medicare plan. Well, there are Medicare plans in Minnesota and most of the country where there's zero premium. They operate on the assumption that if you're using the VA or if you have TRICARE, that you're getting your medications that way. So these zero premium plans don't give you prescription drug coverage, but they do give you really good dental coverage and eyewear coverage. They give you a free gym membership, and they pay you back like $100 a month on your Part B premium. So instead of you having to pay $202 on your Part B premium, it brings it down to $102. So there are plans like that available in Minnesota and across the country if you're using the VA or you have TRICARE for life that work very well with those. Yes?
So turning 65 this year, hoping to work for Mother Mayo another 2.5 years. And so when would be a good time to reach out to you?
Okay. So you can reach out anywhere from 3 to 6 months prior to retirement. The question was, she's going to be turning 65 but continue to working for another 2.5 years. Yeah, 3 to 6 months before you're going to retire. If it's 6 months out, we'll just walk you through the steps you'll need to do. And then 3 months out, we could actually help you get signed up if you want help with it, signed up for Medicare Part A and B, or again, you can do that on your own online or at the Social Security office, but some people aren't comfortable with that. But yeah, 3 to 6 months before retirement, reach out and we'll be happy to schedule. If you want to do a face-to-face, we'll be happy to do that. Mm-hmm. Any other questions? Yes?
Once you sign up, like in that 3 months before, 3 months after, month of, when do they start covering?
So if you're in your initial period based on your 65th birthday, it would start the first day of the month of your birthday. If you're doing it based on retirement and you're beyond the age of 65, when you apply for Medicare Part B, there's a remarks section on the application where you can tell them. It'll always be the first day of the month. You can tell them what month you want your Part B to start. Your Part A, they're going to backdate 6 months for whatever reason. And because they backdate your Part A 6 months, if you're beyond the age of 65, that's what affects if you contributed to a health savings account or an HSA. Because they backdate, that's why you could get penalized if you were contributing to an HSA. But I don't know if that answers your question. Okay. Any others? Any questions online? No? Okay. Well, you have our contact information, and these are our agents. Yeah, if you do have questions, you're welcome to email them to us or give us a call on our phone number, and we'd be happy to help you. So I'll be around afterwards if you have a question maybe you don't want to ask in front of everybody else, but that's the presentation, and thank you for coming. Thank you.